Well, we are steeped in what everyone is calling political reform as we approach an election. And as usual, the public sector is either a goddess not to be touched or the destroyer of our future because it's run by corrupt managers and difficult doctors and so on. Both those stories are both true and wrong. So what's interesting about the public sector is that it is doing exactly what it's designed to do. That we think acute services matter more than we think primary services matter. So we pay hospital consultants shed loads more than we pay GPs. That's, as a society, something we've collectively chosen. Now, most folks think we never chose that, we just drifted in here. And I absolutely don't believe that. So the only way, as a society, we would get a different health service is if we thought about what health services were for differently. Two things that we'd need to do. One is, and these are internal and external. So one is what many people are calling co-production, and the public guardian says banned from its language because no one understands what it means. But what if we were going to say that public services are made together between professionals that try and deliver those, policymakers that set the framework, and public service users and communities? What if collectively we co-designed and co-produced those services? How would that look? That would look radically different. That isn't about electing schools. That's about saying, what's the future of this and how do we, in the moment, co-create a different health service? So that's one that you could do. And what would that look like? That would look like citizen involvement in trusts, holding citizens accountable for how trusts behave. It would look like doctors listening very differently to patients in their surgeries and their outpatients, looking at them as experts, not as deficits that need fixing. A whole different mindset across the system. That would mean that you would go to your GP not to solve your problem, but to be a partner in how you solved your problem. So those would be very different ways of operating, but would lead to radically different health services. So that's the first one. How about we think about health as a co-produced outcome, not something that health services do for us. Second one is around innovation. What happens in health systems is that anything new gets added on to everything else that's going on already. And so you see money as an allocation to be spent on behalf of a population to buy what they need. I see money as an investment. I see it as a resource. So that in order to invest in a health future for local populations, they need to disinvest in some other stuff. So how do you know what works and what doesn't work? Previously, we thought markets would solve that, and therefore you'd have failing trusts and you'd get rid of those bits of the service that didn't work. And we know from the inquiries, public inquiries last year, that we have some devastatingly horrific stuff going on in our health systems, as well as some fantastic stuff. But actually, both are equally valued because we don't know how to stop doing stuff that isn't working. In fact, we don't even have a decision-making process for how you would know something wasn't working. So I think we need rigour in health services about what we're going to invest in and what we're going to disinvest in. We need a decision-making framework that allows you to make judgments about what not to do anymore and why you're not going to do it, and an accountability framework that allows that to be a public conversation. And at the moment, we have none of that. That's my second one.